have Muse Laroyia, who's a master's student at the University of Calgary and co-lead of the Brain Climate Equity Collaborative, on your presentation for the Brain Climate Equity Collaborative.
Hi everyone. Hi everyone. Thank you so much for being here. And if I look better in that picture, it's because that's before I started working in the climate change world. It's still me. Today we'll be talking about the Brain Climate Equity Lab, or Brain Seed Lab as we call it, which is co-led by me and my absolutely amazing co-founder as well, Bobby, who you had the opportunity to hear before. Perhaps we talk a little bit more about the brain when it comes to the climate crises. We're always talking about our lungs, we're always talking about allergies, but unfortunately we're not talking about our brain enough. And that's why Brain Seed Lab came about, just from a little discussion about how there's this huge gap to address when it comes to our neurological health, our mental well-being, and the impact climate change is having on it. To say the least, this Venn diagram is essentially what we are at the intersection of brain, climate, and equity. We talked a lot about today about how there's disproportionate effects on these equity-denied communities of climate change, of the climate events that are happening. And when we add another layer of neurological health, we see little to no action being done in this space, which is why we put together this team of neurologists, physicians, researchers, and fellows to start talking about this, start addressing this through research, education, advocacy, and innovation. Our mission and vision, of course, our mission is to fight climate-linked brain harm through, as I said, research, awareness, innovation, all centered in equity. Our vision is a climate-resilient brain health for all, embedded in policy, embedded in our day-to-day decisions, not just in the healthcare system, but also in education, also in innovation, in something even as judicial as investing in our future. Why this matters? Well, brain health is climate health. If we don't have brains to run our bodies, we don't have brains to run our day-to-day lives, we are not going to get far as a human, as humans in general. So that's kind of why this is such a big deal. And then number two, of course, when we add layers of equity, when we realize that this is disproportionately affecting equity-denied populations, anywhere from rural populations, indigenous populations, to pregnant women, to children, it becomes even more critical because those communities are hit hardest, yet their voices are often excluded. This is a clear system blind spot that needs to be addressed. Healthcare systems need to, we do prepare for cardiopulmonary climate impacts, but unfortunately, we rarely talk about neurological impacts. And how are we doing this? How are we integrating brain health, climate change, and health equity? We're doing it through the generation of evidence. Currently, we have research going on to understand the neurological impacts of climate change. We're doing this through raising awareness. We're engaging clinicians, policymakers. Even me standing here today is raising awareness on the impact of climate change on neurological well-being. Through digital outreach, education campaigns, knowledge sharing resources. We're driving systemic change. We're advocating for the integration of brain health equity into our day-to-day lives, anywhere from health policies to decisions in investing. And lastly, fostering innovation that's advancing equitable, community-informed solutions that support a preventative healthcare system rather than one that is based solely on treatment. We have a lot going on, to say the least, so I don't expect you to read all of this, but to summarize it, as I said, we have a lot of current research going on. Our biggest focus right now is the analysis piece on misalignment between Canadian and WHO air quality guidelines. I know that was the PM 2.5. Impacts were discussed before, and I will add that we are anywhere from 80% to 200% unaligned with what WHO is calling safe compared to what we're calling safe in Canada. So all that information about PM 2.5 times it by 200 and see how you feel. We're working on a scoping review which is underway on the climate impacts on brain health and mental health. We have 3 articles in progress. We have lots of conferences to attend. We're working with neurological clinics to create infographic clinical toolkits, one of which is focused on the impact of plastic and the impact of the consumption of microplastics on neurological health. Systemic change, we're formally launching on November 7th. We're working on a partnership with the City of Hamilton to work with them to create indicators to further our work in neurology and climate change. And then also we partnered with the International Neuro-climate Working Group to kind of form this international partnership. In terms of innovation, of course, we have a website. We're going to be partnering with health hackathons to create solutions that are sustainable in the long run when it comes to this work. All of this could never ever be done without the most amazing core team that we could ever wish for. As you can tell, we're kind of all across Canada, and we also have Bertrand, who is the head of the International Neuro-climate Group. And that's pretty much it. If you're more interested, please scan the QR code and fill out the interest survey. Thank you.